it just brings a spark of light and joy, and it's so exciting.
I remember the first vaccination we did in the province. Bonnie Henry did it. She came to Vancouver and she vaccinated a long-term care worker. Everybody cried. It was amazing. It still makes me cry a bit. But, you know, I think for us, we were sort of embarking on a process of delivering it as a province that was pretty much the way we always did vaccines, but it was very clear to everyone that that was not going to work, that this was massively different. We'd never done this, and it needed a completely different approach.
Once those vaccines were made available, we had to create the capacity and a single approach to actually vaccinate the entire population. At the time, we did not have a single provincial system that could be used to allow 4.5 million people to register and book and receive a vaccine of this importance. So the team was responsible for putting in place a system that was really critical to deal with this global pandemic, and we had literally 90 days to pull it together.
We needed to make sure wherever you were in the province, however you were connected by internet or not, what languages you spoke, or whether you had different abilities, whether you needed a screen reader to use the internet, or whether you needed support to be able to get to a vaccine clinic. All of those things could be accounted for so that we can maximize the opportunity for British Columbians to go and get their shots. The partnership between health, citizen services, GCP, and the Public Health Services Authority was so important because each of us had a different aspect of what was really needed to be able to help make this campaign a success. So within citizen services, we had fabulous technology knowledge inside the Office of the Chief Information Officer. Inside Service BC, we had incredible contact center knowledge and front counter service. Inside of health, of course, we had deep technical knowledge, the public health knowledge, and leadership around setting the direction for how that campaign needed to work. And in the Public Health Services Authority, we had a fabulous partner in being able to working with those systems that were scaled out across all the different health authorities. And key to the partnership was government communications and public engagement. They were so fundamental to be able to help get us approved information that we could then get out to the public through all of our different channels, and ran incredible marketing campaigns. You know, it was just such a huge credit to them as well.
The results of the campaign speak for themselves in the sense that British Columbia has one of the highest COVID vaccination rates in the country, if not the world.
It was an incredible amount of work from, you know, the government all the way down to, you know, line staff in the health authorities and pharmacies.
Vaccines were available within a year of this new virus being detected. And that is, I mean, it's nothing short of miraculous. This was the largest immunization campaign that we have ever done in our history. And we're now up to about 12 million doses of vaccines that have been given across British Columbia. We have one of the highest immunization rates in the world here in British Columbia, and I'm really proud of that.